Hi, my name is Prakash Adhikari, DBA student at California Intercontinental University. Today I'm going to make a brief presentation about change communication to staffs at Springfield Hospital. Hi, good morning all the amazing staffs of Springfield Hospital. Today I'm here to make a small presentation about the medical prescription error related problem that your hospital is facing. Let's talk about what is the prescription error. Medication prescription error is described as an error at any step in the pathway which begins with a clinician prescribing any medication and it ends with the patient receiving the prescribed medication, and the adverse drug event is defined as a harm done to patient due to the medication. We need to change our system to solve this prescription related problem. Your hospital has recently implemented sophisticated computerized physician order entry CPOE system. It is supposed to improve the prescription related errors substantially. But unfortunately, that could not happen. I found from the report that it's further deteriorating. Let's talk about the data. Adverse drug event kill or harm more than 770,000 people in United States hospitals, which adds several $100 billion cost every year. So what can be the causes of the prescription error? I believe you all know better than me. Everybody know that lack of knowledge about a medicine and how it would be prescribed could be the primary causes. And more than that, it's not the case in the hospital. We have very proficient, very specialized doctors, pharmacists, everyone there. That shouldn't be the case here. Most of it seems like teamwork related. Maybe we lagging somewhere in the collaborative endeavors, or we not having an efficient and effective communication system. To rectify this problem, definitely the collaborative care system will help. So what are the hindrances to the collaborative care system? It could be categorized in three categories: clinical barriers, organizational barriers, and financial barriers. In this case, in your hospital case, clinical barriers and financial barriers, I don't see much problem in these two categories. The most of the problems are related to organizational barriers to implement a collaborative care for delivering the holistic, value-based patient care. Most of time, the prescription-related errors are because of slips and lapses by staffs. It happens while prescribing a drug, and that could end up with a different hazardous medication. How we can prevent slips and lapses error? Definitely, we need to change in our behavior, communication style, and process. Of course, every time checking the prescription before another staff signs them. Having a low threshold of double checking side effects and indications before applying the high risk medication. That could help to improve the situation. And hospital has invested a lot of money to implement computerized system, CPOE, and adhering with the proper IT rules, being trained about using that system with the disciplines and team efforts. Definitely we can turn around the situation and we can create the error-free prescription and add substantial value to our healthcare services. The staffs of different teams, disciplines, and departments should adhere and comply with newly made IT rules concerning with medication prescription errors. Adherence to the organizational guidelines is as important as best clinical practices, and both should be done simultaneously to bring a practice change. And another issue, definitely, in verbal communication is also the issue related to the prescription orders. The verbal communication in prescription orders must be limited to emergency and critical situation where written or electronic communication is not feasible. Providing a mechanism that ensures validity and authenticity of prescribers. You need to know where the verbal orders can be used. Of course, your great managers will facilitate you for this change. Get furnished with the sufficient knowledge, skills about the system. Be committed for the error-free prescription so that we can substantially minimize the prescription related errors that Springfield Hospital is currently facing. We can make the best use of the CPOE computerized system, which will help us to reduce the prescription related errors, but system itself doesn't work. We, the people, make the difference for the error free. That is just a tool that facilitates us, but we need to use the system in the very efficient, effective, and disciplined manner. This was a very brief presentation, but you will be facilitated very well from your managers for implementing this change, and you will be the key player for this change to make happen so that Springfield Hospital will be well known as a prescription error-free hospital. This is all about. If you have any questions and concerns, please feel free to ask me. Thank you very much for your attentive participation. Have a wonderful time.